Hey, thanks everybody, and welcome back to the Awaken Alive podcast. I'm your host, Mike DeCroche, along with my co-host, Mark Smith, and our guest, Dr. James Spencer. Before we get started, just a couple reminders to please go out and check out the website, IamAwakenAlive.com. On the website, we got a lot of free information, great articles and writers covering everything from lifestyle and fitness. The website, you can also replay any of our uh, previous podcasts on the website, or also download it in iTunes. So please subscribe and support the show. Also, you can currently get 20% off in our store with promo code IamAwake20. And also, just plug our new online training portal, which features over 12 full programs, over 150 exercise tutorials that Mr. Mark Smith himself put together. Follow along videos, ebook downloads, it's all there. We're giving away $100 in supplements and a free t-shirt to the first 15 people that become lifetime members. So please go out and check it out, and tell us what you think about it. But anyways, Mark, I will turn it over to you with that now that that's covered.
All right, awesome job, Mike. And yeah, welcome to the show, Dr. James Spencer. I think James and I found each other somewhere along the way via Instagram, I think. It was either Instagram or Facebook first. I do not remember, but I know that we have actively communicated through Instagram for a while now.
Definitely.
Supporting each other's ideas. Is that right?
You got that?
Is it Instagram?
Yeah.
And yeah, we've been sort of actively going back and forth, supporting each other's ideas, and really been impressed with one another's work and getting stuff from. So listen, everybody, sit tight. I'm going to go through this guy's bio. It is really awesome what he's bringing to the table tonight. We're super excited to have a guest with this this sort of accolades with him. So Dr. James Spencer is a sports performance chiropractor, a certified athletic trainer, and a fellow of the International Academy of Medical Acupuncture. He's original from Sarasota, which is in Florida, but he works in South Florida. Each individual encounter or training session allows him to positively impact his client, and for that he is excited to be able to share his passion with others. So that's what brings him to the show. He's just real passionate about what he's doing, and we've got some cool stuff to talk about. I'm pretty excited. His physical background is he likes to train with kettlebells, Indian clubs, steel clubs, bases, juggling, skateboarding, surfing, wake skating, paddleboarding, slacklining, climbing trees, and enjoying life in South Florida. Sounds like a pretty active guy, my kind of guy. I like it. He's written multiple guest blogs for John Russin Fitness Systems, and he's actually got an article for us that he's going to send to. Actually, I think it's a two-part series, if I'm not mistaken. I think we're going that direction with it. So we're looking forward to having that on the Awaken Alive website. And his formal training is active release techniques, or ART, Graston technique, Kineticore, functional dry needling. Looking forward to talking about dry needling on the show. Spider Tech kinesiology tape, rock tape fascial movement taping, FMT, Postural Restoration Institute, PRI, Y balance test, YBT, functional movements screening, FMS, selective functional movement assessment, SFMA. I am familiar with those previous three mentioned ones quite a bit. Mike Boyle's certified functional strength coach, and Onnit Academy of Unconventional Training. So the last half of that paragraph I'm quite well versed in myself.
Perfect.
So pretty excited that we have some common ground, and let's open it up with just sort of, what got you to where you're at right now, sports chiropractic.
Yeah,
we'll start there.
It's funny. Growing up, I always wanted to be something active, whether it was involved in sports or health, and then I had a few life-changing events of friends getting cancer and stuff like that has led me down the path of health. And that has truly kind of engraved me into that holistic pathway of of athletic training and helping, that preventative measure of sports, and trying to teach people like the FMS systems of, hey, let's see if we can prevent some of these asymmetries from maybe leading to a deficit later down the road or an injury, actually, when I was working with the Jacksonville Jaguars as an athletic training intern, I saw what sports chiropractic could really help. And these guys doing some ART coupled with some manipulation and rehab, and that was like my wheelhouse. So when I decided, I was like, you know what, I'm going to do chiropractic school. And it's funny, even in the athletic training program, it was kind of looked down upon just because of that AMA style of things. But I love the holistic approach, via nutrition and movement and manipulation. So that, with the adjunct of dry needling and rehab and soft tissue manipulation, it's vital for that component to really help people.
Yeah, I was actually on the phone with a chiropractic friend of mine here in town, Dr. David Russ. Great guy, big fan of my work. Just going over some X-rays of a client I've got coming up here tomorrow morning. The guy's got rods all in his back. It was, a botched surgery. I think it's called, is it the Patterson's surgery? Is that what it's called?
A couple Harrington rods in there, yep.
Yeah, that's what it is. And he was telling me it's actually banned in Europe now. Like, no doctors will even do it because it's so barbaric. And this guy's my age, 31, and so I was picking his brain for it, and just how can I use his expertise as a chiropractor to help with what I know with the FMS, with my work with Ido Portal, my work with Erwan Lacour, just
Sure.
these movement ideas, and it's like, what can we do to help? And I think it's really big to draw on other networks and stuff, but it's amazing, and I think we're really going to be able to help this guy a lot. But it's just, I think it's so cool, and it's, you're our first doctor on the show. You're our first chiropractor on the show. We're really excited about that.
Awesome.
And as well as I do, here you are saying, like, I'm coming from a holistic approach, but there's been this long time sort of, not sort of taboo, but reluctancy. I think that chiropractic care has really grown by leaps and measures in the last decade, but before that there was a lot of hesitation to go to a chiropractic doctor. What have you seen in the field that has changed that perception? Like, a lot now, you say it, and most people are like, sure, I'll try it.
You know what? It's funny. I don't even approach the topic of saying that I'm a chiropractor. I say I'm a sports medicine provider. And
Okay.
if somebody wants to know a little bit more about what that means, I may tell them, hey, I take a more movement-based approach, and just recently I went from the whole insurance-based model to strictly cash only, which has allowed me opening up multiple doors of spending 2 hours with a patient if I'd like, and really getting to the root of the problem to help the issue, as opposed to, hey, justifying another 6 visits for somebody that really needs the care,
Yeah,
So,
that's how my chiropractor is. It makes it so much easier just to walk in, give them cash, no hassles, no billing or
totally.
flexible spending accounts. Simple.
And that's what makes things convenient. And like, hey, I say, listen, we're not here to sit here and bullshit somebody. We're sit here to get to the root of the problem. And I see a lot of chronic pain patients because they've been to 30 or 40 people prior to me. And I film everything, so I take that objective measurement of, hey, you may think you're moving a certain way, but this is how you're truly moving. And then maybe in 3 or 6 weeks we reassess you, and that provides us an objective measurement of, here's the proof in the pudding, And that's why I like spending time with people, and listen, it's an interconnection. It's a family and developing a relationship with the patient to build that trust factor to buy into this system. So that's what it really comes down to, is providing that friendship and letting them know, hey, you actually give a shit.
Yeah. I think if you ask anybody I work with, they'll say that, that's like the number one thing, is like, you actually do give a shit. Now, I can't give too much of shit because I got to come across as a little bit of a hard ass. And
hell yeah.
if I come across as too soft, it's going to blow my reputation, and
yeah,
it's not going to go well for me. people think I've been getting all easy on them. But yeah, I mean, if I don't think we get into this service industry that is up and down. You know, you get some clients, you lose some clients, you lose people that are close to you. You get people that you can definitely help, and then for whatever reason they go a different direction, or they decide, you know, I'm still not ready to make that commitment. And when you put yourself out there, not just your knowledge and your expertise of what you can do, but to me, I think it's a really a heart issue, an issue of like, this is me, this is who I am. I genuinely want to help you get better because I don't want to see anybody living in pain. I don't want somebody to say, man, my back hurts all the time. And I know for a fact, Dr. James, that I can do something about it pretty easy. I mean, even if I just like increase their, uh, just a little bit of scapular health, a little bit of scapular work, a little bit of thoracic work, and most of the time that fixes most upper back cervical issues. You know, a little bit of hanging, just throwing that back in the system. It's, look, all you have to do is hang a little bit each day, and it kind of worked itself out. It wasn't like sorcery. It wasn't even hard science. I just got you to do something that you've been neglecting that really helps the system. So, I definitely know where you're coming from. I understand that, and I think it's cool that you've gone to a model that allows you to spend time with people uninhibited. It's like, sometimes you got 2 hours of information you got to give somebody. And versus another model where it's like, oh, I can only spend 5 minutes with a person because I get the next person in the door. So I think that's cool, and I commend you for that.
Man, and I've done the every 15 minutes, and that's a very financially beneficial system. But at the end of the day, we also had an athletic trainer doing our rehab, so it'd be 15 minutes of manual therapy and 15 minutes of rehab for them. So total 30 minutes of treatment, and that was more an insurance-based model, which is still successful, but I like to know what the rehab looks like because I see a lot of competencies or things that I need to address in their movement and rehab. And, with my athletic training background, I believe it's like a vital component that at least I need to monitor to make sure things that aren't compensating in the manual therapy side are carrying over into the actual, stabilization side of things.
Now, I'd be curious, Dr. James, if going to cash, does that hurt your business? I mean, would that be a model that you think would be beneficial across the whole medical industry? Or I mean, I've seen a lot of that, in LASIK, eye surgeries.
That's a big time question there, Mike.
I just throw it out there.
That's a big. Now you're talking about changing the whole medical field and the way insurance works.
I was just curious, why you made that, that change. It seems like I don't know. It always seems like that's where all the money is. It all flows through the insurance company. So why would you want to bite the hand that feeds you?
Yeah, in that system, and a lot of people, I mean, shit, 90% of people that I get referred to me are word of mouth. So they already know what they're kind of getting in this system, and a lot of people find me online, social media or via dry needling websites or whatever it may be, and they are coming strictly for that, and they know, like, hey, straight up cash is not covered. I'm sorry, insurance does not cover any of this, even if I did accept it. So I think that if people truly want to spend proper time and actually give quality care, you need to actually take care and listen to a lot of what the patient's saying. And unfortunately, time is not available in the insurance model. And that is why I see so many chronic pain patients. If you just listen to somebody, they're telling you what's going on. And 90% of the time, you can say, hey, you know what? You are not a manual therapy movement case. I know what I typically see. And something's not going on here. Like, I just referred a girl out to get her blood and hormone panels run, and sure as shit, everything's off kilter. And she just wasn't recovering from any workout or any rehab, and that's just odd. When you follow the system, something's not right. So that's why, it helps to refer out. And you know what? I actually referred her to a cash-based system, and they spent an hour going over her blood work with her. And she calls me up today thanking me for that, and she's like, it was expensive, but you know what? I always say you can't get a Ruth Chris steak for a McDonald's price. You know,
Yeah.
when you go into that steakhouse, you know you're paying $100. You know, and that compared to the 15-minute system, I mean, it's just blowing it away. And word of mouth referrals, I mean, I can't be any more grateful or thankful for them.
For sure. Every time I go to the
think my
doctor, I
wife
get
can
a
actually make a better
script.
steak than Ruth Chris.
I'm sorry?
I think my wife actually makes a better steak than Ruth Chris. I'll put it in the battle. I will. I'll throw her in a head-to-head with their best chef.
I'm
She
saying
makes killer steak, dude.
I'm saying a Taste of Texas out in Houston may have her.
Where are you at, James?
Currently I'm in South Florida.
Oh, that's right. That's where you said. Where at exactly?
Yeah, I'm in Delray Beach.
Oh, nice.
Okay.
I'm not sure where is that. Is it Gulf side or?
No, East Coast. Yeah,
Okay.
just
I know
south,
where it is.
just near West Palm, kind of Boca.
Oh, okay. Do you work on a lot of old, wrinkled clients too down there?
Absolutely not.
No. Don't want to rub
No,
down old ladies.
no, they're all looking for the Medicare system, and unfortunately,
Mm-hmm.
I take that back. I do see some, mid 60s women that are golfers and still love what I do and will pay me cash for that,
Mm-hmm.
and they don't mind. But rarely, probably my average client is mid-teens to probably mid-40s.
Oh, okay, nice.
Yeah,
So what does your approach look like?
Like you're saying, a typical patient walks in, and what do I do?
Yeah, where do you start? How do you progress through them? And
Hey, like Stu McGill says, the history and the observation occurs right when they walk through the door.
that's
So,
true. Watch them walk.
yeah, I mean, it gives a huge tail, and then when you have them walk down the hall after treatment, they're going, "Holy shit, I got better hip extension." They don't realize it. You're observing that, going, "All right, we know we've made a change," you know. So that's big right there. But when they typically come in, I don't like to go too much into the history right away. I like to just kind of just let sit there and ask a couple of questions more about what are they doing actively. Get them engaged in more of, hey, these are things that I'm not doing or maybe doing, and things that I may need to pull some things out, and that may be the best recipe for their rehab. So that's where I start, and then I get more into their, are they in pain? I don't see a whole lot of people in pain just because it's more a performance style cash-based model, which I'm fortunate for, but I do have a handful of chronic patients as well that you approach and you can only help so much with structural limitations,
Right.
But they'll come in, get to that history, ask a lot of questions, and if that takes an hour, so be it. A lot of people just need to talk and let things off their chest, and you got to listen, and that's going to tell you 90% of what's going on. And
Yeah,
from there, go ahead.
Yeah, so I kind of in the same boat. I'll usually deal with a phone call first, and that can be anywhere from 15 to 30 minutes, depending on how chatty the person gets. And then I say, come in for an hour assessment, and we spend 40 minutes to an hour talking again, going further. And it's really, I just said, tell me everything. Like, if you fell off a bike when you were 17 or 15 or something and twisted something, I want to know about it. And if you didn't tell me, it's going to show up when I do my FMS and do some gait work with you. I'm going to see, hey, any issues with that left ankle? Oh, yeah, I was in a car accident when I was 22, forgot to mention that. And, yeah, it impinged my ankle pretty bad. So, it's like you let them do the talking, and through the narrative and the history of what they've done, every traumatic thing that's happened to their body, every body trauma has left an imprint and an echo that you're going to see in their movement patterns. And then it's going from there.
And it's a coupled system of things. I kind of, it's an art, a lot of this. So you may have the
ART,
FMS
active release technique.
No, meaning
I
like
was just
little.
doing a play on words there.
Smart ass.
Yeah, I know.
I love it. And that's like a lot of what it comes down to is like taking a coupled system of things and like putting your little twist on it and making it an art, and that's where that's where I like, having fun with a lot of this.
Or the Bruce Lee approach, use what works and throw out the rest,
Totally.
Hey,
and then make it your own. That's
Yep.
the last part of that.
Dr. James, what were all those purple bruises that were all over Michael Phelps during the Olympics? Is that something you ever get into?
You know what? I do a little bit of cupping. I like to personally. I do a lot more dry needling. With my acupuncture, education, I learned a little bit of the cupping system. It's an old ancient Chinese medicine. Just similar to like gua sha.
Mhm.
And it's more to bring that stagnant blood to the surface and let the body recycle it. But I like the more of the dry needling effect on things to stimulate more of the muscle and the fascial system, where cupping may not have that whole effect on it.
How exactly does that work? It's it's one of those things you see all over Instagram now. People showing off all their bruises or
Yeah,
hickeys,
There's
self-induced hickeys.
absolute polarization of it on social media. It's like so many people are saying,
you're
Joe, I've had companies on, it worked great. I only speak from experience. If I haven't tried it, I'm not going to speak on it. I tried it, had success, I liked it.
And you know what? I've had great success with it as well. It's just not a convenient tool that I like to go to. I want a quicker response usually with the dry needling, and that's typically what I find. And I just honestly, I don't have enough experience with it to completely expose it.
Yeah. Well, what is dry needling and how does that work? Well, why would somebody want to do that?
And it does work. I used it on my shoulder when I had physical therapy last year.
Yep. Yeah, dry needling
I'm gonna
is
let you talk
awesome.
about it because you mentioned it a bunch. So yeah, let's hear it.
Dry needling is awesome. It's interesting. I wrote an article on the difference between that and acupuncture in the sense of, hey, I just wanted to educate people more on what dry needling really is, and a lot of it goes back to more of that myofascial trigger point system, based off of Travell and Simon, and hey, let's get a twitch response in the muscle and elicit a response, and let natural painkillers and signals act to that area and reduce tension and hypertonicity, and it's phenomenal for pain reduction and increased range of motion almost instantaneously. So it's a pretty cool modality. I'm very, very fortunate to have it in my toolbox.
So I was in a long comment thread one time. I think it was on something Dave Hedges, who was a guest on our show at one point, said, and I was basically saying something, and ultimately I said, you need to create space to allow healing to occur. And so a year ago, springtime, so not this past April, but the April before that,
Mm-hmm.
I believe it was, I had to do some physical therapy on my left shoulder. Yeah, bursitis, tendonitis, you name it, just all sort of flared up and it was just mad at me.
Just beat up, yeah.
It was just mad, like angry all the time at me, just hurting. Couldn't even pull the sheets over like this much, and pulling the sheets up would just kill me at night. And so I was doing some rehab with the guy and physical therapy, and the guy was real big on dry. He said, "Try this out," and he got sort of the same explanation you gave, where it's firing off these like minor little muscles, and then all of a sudden when they start to work, these big muscles have been overactive and just kind of almost not stuck's not the word, but it's just like they're on all the time.
Mm-hmm.
And because they're on all the time, they're putting
Hey
pressure
guys,
on
keep
everything
going.
else.
I gotta check something real quick.
Yeah, go
Keep
for it.
going.
Because they're on all the time, like there's this lack of space that was going on in my shoulder, and it was creating that inflammation. Some of these little ones get fired up from the inside out, more or less. It just sort of brought my whole shoulder, my whole trap just sort of let go. It came down, and ultimately it was a trap problem that was more or less causing the tendonitis and bursitis.
Is that what he dry needled with the trap?
He came down. He did that. That was fun. That was a lot of fun. And then he really what was it? It was sub and suprascapularis was the primary thing that we really started to get some. When he got that subscapularis up under there,
Yep.
Sorry about that, fellas.
And teres major. When he hit that, I definitely felt that. That was the only one that actually hurt. The rest of them just feel like a little tiny tickle.
Yep.
A weird tickle, but the teres major was it was on, and it was.
And now let me ask you this: how instantaneous was a lot of that response?
Okay, so I had sort of an abnormal response to the physical therapy. So my first 2 weeks went fantastic. Like I kind of walked out feeling pretty good. I had an increased ROM going overhead. I mean, I was stuck at I want to say I was at like 130 when he first did the measurement. You know, when you should, you know, ideal would be, you know, if you can get that flush to 180, which a lot of people don't even have that. Most people,
Right.
but really getting that angle open, and so we saw some movement there going back and no pain, and also I had where, you know, if I was coming up on the outside in this plane, everything's going good until I got right about here, and it was just pain, no pain. You know, I just kind of moved through it. So it definitely, the first time like I came walking out, I was like, oh, I can feel that's kind of nice, and I think that was, you know, sort of not what I expected. Now, my mom is an LPTA, a geriatric LPD, so I'm very familiar with physical therapy and that approach. But of course, she's 38 years into it, right? So I mean, the knowledge and things are changing, and what she does totally works. But it's this process and this time. Like a lot of times, she's teaching people how to walk again or just keep them walking. I mean, it's the crazy stuff.
Totally different rehab.
Totally different, absolutely, totally different, right? So, but I never really thought of physical therapy as overnight success. That's the point I'm trying to make there with the two ideas of it. And then second session, a week later, was doing my drills. Everything's fine. Come in. And second session, I mean, I don't know if we overdid it or what, but like the next day, I was like 10 steps backwards, and obviously frustrated. So come back in, and then we just added in, we took one exercise out, added two other ones in the rehab program, and he did one other thing with a little ultrasound with the dry needle, and kind of combined it for that one session. And from then on, it was just a quick 5 weeks and totally normal, full functioning shoulder. So you know, I spent money on 7 weeks, and for me, it was an option. I need this to do my job. Like, I have to be able to use my shoulder to pick things up. It's very vital for my job, but also, you know, it was bugging me. I couldn't pick up groceries. I couldn't, you know, grab my kid if they jumped on me, stuff like that. You know, it's that day-to-day stuff I had to get around.
And shit, that ain't fun either. Working around in pain ain't fun.
Okay, so our major topic for the night that we talked about ahead was I wanted you, we talked before this, I wanted you to talk about the unconventional approach to rehab. So we're an unconventional site mainly. We do a lot of unconventional exercises, but how have you been able to assimilate unconventional methodologies into a rehab setting?
Yeah, I love it, man. It's kettlebells is something that I've gravitated to, like literally right when I was getting into athletic training. And I was more of that bodybuilding style, and then I realized how valuable kettlebells were, and leverage points, you know, to put joints into proper position and to create advantageous strength positions from that. And you know, obviously you owe a lot to Pavel and what he's done for kettlebells, and learned a lot from him. And John Wolfe has been a big influence of mine with you know, a lot of the On-It systems. He's a phenomenal reference for you know, proper breathing mechanics, and I mean, the man kills the steel clubs. So you know, a lot of his previous work is influenced a lot of the ways that I approach my rehab programs.
Do you train out of your office?
I train everywhere, but yeah, mainly out of my office, and then outside at the parks and whatnot.
Nice.
So if you have a client that comes in, and let's just say, let's use one of your golfing ladies, right? They're 60-some years old. I know it's a little bit outlier. We'll do one of your outlier clients, and we'll do one of your more typical clients in the age bracket. Perfect. So we got your outliers, your kind of young 60s, very active, still want to keep their golf game, so they're going to need great hips, great thoracic rotation, and fairly open shoulders. What kind of unconventional exercises are you prescribing to them to help enhance those patterns?
You know, number one, starting with breathing. Breathing is phenomenal for just thoracic movement and rib cage movement. which is obviously, very important for the golf game in general. That is number one, and you can see how much that even carries over into a lot of overhead mechanics and throwing and whatnot. But the approach that I like to take with the unconventional portion of those women is get them into a lot of half kneeling positions. Get those hip flexors open, and you know what? Get them just swinging some Indian clubs.
Right.
That's gonna strictly posture them up and get a good stability into the hip, and allow good internal and external rotation of the hips at the same time. So it's fun for them because that's something they may have done back in the day, or they may have never seen. And once you jump into that, then they're sold. It's funny. I had a guy that came in and he actually purchased 6 pairs of Indian clubs after working with me for about 12 weeks, just because he was so into it. He was so into it.
Yeah, the clubs are great. When you I'm a big fan of the half kneeling position too. But what, from a medical perspective, chiropractic, sports medicine, athletic trainer, sort of that Mod Podge, the background that you have.
Sure.
What specifically does that do? So if we got our listener here, they're maybe not familiar with the advantages of the half kneeling position. Kind of go into that, break that down for us, because I think it's real specific that you pulled that out of all patterns that we could possibly be in.
I think
for a golfer.
Yeah, I like that position, number one, because it's a shorter lever arm. Get them to that knee. It forces that hip flexor to really relax, or it's going to stretch the hell out of it. And that may be a static stretch, but you could almost PNF it, where you get that glute to contract, really get that psoas or whatever hip flexor may be tight to relax. And that's something that's going to allow their hips to open up and reduce low back tension, which most mid-60s women or men have at that standpoint. So that's number one, and really getting the glutes to fire. That's the one thing that I find in most people is A, the inability to even realize how to do it, or B, they have no idea if their glutes are firing or their quads. So it's a perfect position for that.
Now, is that just a symptom of too much sitting and just lifestyle, and that just those muscles just go to sleep and never wake up?
Gluteal amnesia, baby. Yeah, that's one of them. I had somebody ask me, how come I don't feel like my ass works? I said, what do? Sit. So lawyer sits, 8 to 5 all day, comes in, works out for an hour, and says, why do I have tight hip flexors? So, when you spend 80% of your day in that position, it's going to be what it is, You got to combat that and get up and move around, every 15, 30 minutes if you can.
Yeah, definitely. We try to push the movement snacks. Try to push that. Anybody that listen to me, call a friend, do something, go refill your water. Anything you can do just to move a little bit. I like those desks that actually change the levels. Standing to sitting to actually, if you can get all the way down, that's great too. Floor sitting's amazing for the hips. Okay, now let's go to your. All right, you've got a range 16 to 45. Are most of these athletes? Is that safe to assume, or what? Are we working with athletes primarily? I don't know if you mentioned that earlier.
Yeah, I'd say probably 90% of the population that I work with is athletes.
Okay, so what do you implement with this crowd?
Yeah, right now my main market, honestly, just because of where I'm located, kind of here in South Florida. I'm also located out in Wellington, Florida, which is kind of the equestrian capital of the world. So, the
Olympics are the only other time people watch horse equestrian.
It's crazy, man. It's crazy, but there's a lot of money involved in that. They think there's money involved in golf and stuff like in tennis, but there's a lot of money involved in $500,000 horse and the care that they want to provide, and posture is vital for a lot of these sports in equestrian riding. So that's one market that I'm working with. Obviously CrossFitters are big, and then a lot of baseball players as well, just being down here in South Florida.
And speaking of baseball players, you worked with so I remember I messaged you. I was at a lecture with Cressey, and he showed a picture of you, which was just for being a good student. You showed up, you were polite, you listened, you took notes, and we were talking about being good students. And I think anybody's worth a damn in this industry is a perpetual student. But So he's like the baseball guy, right? I mean, that's kind of his niche that he carved out there. Obviously, there's a huge market for baseball players in South Florida. What were some takeaway points from Mr. Cressey? And you're just sort of watching him.
Yeah, you know, I actually went to I think 2 or 3 of his seminars down here before I really got involved with working with them, and you know, just learned a lot about the evaluation of the upper extremity, whether it was mid back, T-spine, you know, scapular movement, clavicle. There's a lot more dynamics to the shoulder than people realize, especially when you are working with overhead athletes and pitchers. So that's something that, you know, I definitely took away is not everybody is going to have the same approach or outlook based upon a flat T-spine or more of a rounded T-spine. Like, that is going to play into the huge dynamics of the shoulder blade and the actual shoulder movement, and not a lot of people look at that. So, you know, when somebody comes in, I do a lot of the SFMA and whatnot, but hey, if I've got an upper extremity problem, I want to see is the scapula moving? You know, for example, I had a guy this morning came in with elbow pain, and sure as shit, his shoulder blade was locked up, wasn't moving for anything. Lat was locking it down, and no upward rotation of the shoulder blade, and it was just locking down everything on, you know, the posterior side of the arm, creating a ton of tension and pain. And we released, you know, via dry needling that shoulder blade and lat, and the pain went away. So that's one approach that we take to that, and that's kind of how we took things to get it, you know, the approach to get into that, and Eric appreciated the dry needling effect of things and wanted to provide that for a lot of his athletes. So that's kind of how I got my foot in the door with them.
Oh, sweet. Yeah, he's a cool dude. I was very impressed with. Well, I've always been impressed with his writing, his articles, but I was impressed to hear him speak.
Yeah, he's a huge mentor of mine. I've been listening and to a lot of his stuff and reading his work since like 2008. So, you know, definitely an awesome opportunity to be involved with them.
Yeah, sometimes you get to do that. So covering back in your bio, a couple things that I was unfamiliar with, and maybe this is just a selfish question because I like to learn. What is the Graston technique?
Yeah, so Graston is very similar to what I was referring to earlier about gua sha, which is more of that, hey, let's get into more of a response, an inflammatory response to create healing or an elongation to a lot of the tissue, if it is quote-unquote adhesed or glued up. And the idea behind it is it takes a stainless steel instrument, used with a little medium, usually coconut oil or whatever you may have, and it's used to break up these adhesions within the tissue. I don't know if adhesions are the right word, but whether the fascia is being glued up or whatever it may be, it helps reduce that tension and increases range of motion to that tissue.
So you're talking about like scraping with a metal tool over the soft tissue?
Yeah, I think I've seen it now that you mentioned that tool.
Yeah, I don't know if it is based off of gua sha, but they used to use the old elephant tusks for a lot of that with the old Chinese medicine. Nowadays, yeah, now I guess it is. I have no idea, but you know, nowadays the Graston tools are more of that stainless steel instrument with a beveled edge. So
you just dig at your clients and it sounds like torture.
It ain't that bad.
No.
He says as he takes a sip of bourbon.
Yeah, I'm going to lather you up with coconut oil, and I'm going to dig at you with this shiny steel spoon or whatever it looks like.
Pain is relative, baby. Pain is relative.
Now, okay, great question. So, speaking of pain, you said you actually don't deal with a lot of chronic pain management, but you would deal with certainly a high level of acute pain, right?
No.
They said the guy came in with the elbow, right?
I actually see a lot more chronic pain typically.
That's what you said. I had a backwards, sorry.
Yeah, no worries. Because a lot of people that have been to different systems or different doctors and it just didn't work out for them, and I take the time and really try to figure out what the heck's going on with them. And that's why that cash-based system allows me to do that. But what typically you will do for somebody in chronic pain is take the time to listen to what's going on with them, because the others haven't, and how can we help them from here on out? Even just, reducing that smallest picking at the scab or whatever it may be, creating that inflammation. Let's reduce that, and
Right.
teach them certain things, educate and empower them. How can we help them? So a lot of the chronic pain people, you just have to get them to earn your trust and let them know, hey, you actually give a shit. And if I don't know what's going on here, let me point you in the right direction of somebody that can.
Do you
So
give a lot of homework?
I don't. I
No.
give 2 to 3 exercises max. And most people that I see are already doing a ton of stuff. So
Okay.
less is more for me. And I know they'll be a lot more compliant with 2 to 3 as opposed to 5 to 15.
Sure.
I've seen that, and most people won't do them. So the 2 to 3, and most people will stick to that. And you can tell, depending on how quickly they respond to treatment and whatnot, typically whether they're doing them. So
Now, do you rely? You do a lot of hands-on and manipulating work as well with the dry needling. Is that really where you see the progress? Then, hey, here's 2 things to reinforce what we did, or these 2 things in addition, like to what you just did.
yeah, I do a whole couple of effective things, whether it be, I may do dry needling, I may do grafting, I may do ART and adjust you all in one visit, depending on what you truly need. And I always like to, take the approach of what the FMS systems takes is mobilize and then stabilize.
Yep.
So get things moving and then teach that brain how to stabilize that new range of motion.
We need to get Greg Cook on the show. That'd be awesome.
hmm
Listen to that dude all day.
He's
He's awesome.
he's the man.
Yeah, so great. But I mean, to me, that was, I've said this before. That was kind of my turning point. Was the first time I heard him talk. I'm like, oh, okay, I'm doing everything wrong. Let's start over.
Hey, it's just
Um,
part of the movement journey, man. Part of the movement journey.
it is, and it is a journey. I had one other thing here for you. Just looking back at my notes real quick.
Yeah.
Uh, all right, this is a topic, man. It's kind of a controversial topic. It's not too different than the cupping, which got a lot of press. Mike brought up a good question. It was all over social media, seeing these
hmm
bruises and all the memes and stuff. Everybody waiting on that. But what about taping? You got 2 different taping methods that you use. Let's just ask, does it work? And if it does, why does it work?
If it works and it helps somebody, then who cares, right? At the end of
Yeah.
the day, at the end of the day, that's my approach to things. I don't always need evidence-based to tell me it works when you see it work day in and day out. A
Right.
lot of times, I'll typically tape for inflammation or any kind of bruising or discoloration to help get that interstitial fluid kind of moving. And then I also like to tape for posture, as
Yeah.
well as is to really reduce any kind of hypertonicity or overactivation of the muscle, and try to just honestly help reduce some of that tension into that tensile strength of the tissue. So for chronic strains or any kind of inflammation like that, I like to use that, and it typically will help the patient just kind of stabilize as well as secure it to the body.
So are you just talking about counterbalancing what you see with the person and kind of taping in opposite directions, or how exactly does that work?
It totally depends on how the patient presents, but typically if you got that client or patient that's kind of rounded posture, head forward kind of here versus more of that upright, you can keep that tape on as a reminder. So the minute you start to round, that tensile strength just gives that little pull as a reminder saying, hey, sit upright, and that helps reduce that picking at the scab effect of, hey, maybe your biceps tendinosis or your rotator cuff was because of that.
Yeah.
Oh, I can relate to that.
Taping was part of my healing, and when he taped down those my shoulder blades, it was huge.
Yeah.
I had a workshop I was teaching 4 hours away, so I had a 5.5 hour car ride, and then I had to teach a 4-hour workshop. So he taped me before, and this was like the week of the whole big meltdown. This is week
Uh-huh.
2. Or week 1. No, it was week 1. I went in for my first visit, and I said, I just need to be able to teach this workshop, and then after that, like, so I don't want to do any damage further to what I got, but after this, like, you can do whatever we need to get the thing rolling. So, um,
Just get me through it.
where did you go?
Would you lose us?
No, I think my thing was trying to do an update on me, but well, cool. Let's see here. James, do you have any questions for us? I'm gonna see if we can finish with one more question here. We've got about 5-6 more minutes here.
Yeah,
Do you have anything for us?
I got a few. I like the old Timothy Ferriss question. If you could put up a billboard, where would you put it up, and what would it say?
Good question. All right, Mike, you go first. You're quicker on your feet than I am.
Now is this specific to Awaken Alive, or is this more of a personal philosophy?
Any market.
Oh man, I'd throw up a big billboard that says "Throw away your credit card, man." I feel like next to alcohol, credit cards are the biggest, I don't know, bane on American existence, killing more people, destroying more lives.
I like
Just put it
that.
right on the highway and say your credit card company's full of shit. Credit card points are a scam.
I would put one up in the dead center of the town I live in, Wilmington, North Carolina, that would say "Stop driving like assholes."
Perfect.
Because the traffic is deplorable here. It's the worst drivers I've ever seen in my life.
I love
Your
it.
insurance goes up just for living in this county. It's stupid.
Are we allowed to have two? Because the other thing I'd say is take that stupid smug bumper sticker off your car when you get home, and it just be right. No one cares who you voted for.
Right.
Yeah.
Keep it to yourself.
Uh-huh.
I like it. Yeah, I like it. And then here's my second question. What's the current book that you're reading?
Oh, okay. Hold on. I'll get it and show it to you. It's right here in the
Sweet.
room I'm in.
Oh, he's looking for that. I'll tell you mine. I have two that I was juggling that I haven't finished. One is Rediscovering Jesus by freaking his
Did you
name
get
is
one?
Matthew something, and then the other one is a Dirk Hayhurst book. Your picture, like I'm out of my league.
Yeah, I've heard that one.
Yeah, it's pretty awesome. The whole series he does is pretty great.
How about you, Mark?
Let's see if we can get that. The Naturalist.
Nice.
It is a biography on Teddy Roosevelt that my wife got for me. He's my all-time favorite president slash dude. I mean,
Awesome.
He's a dude, man. Like, the guy
Heck
was
yeah.
a fighter and a warrior and loved being outside, and he founded the national park system, which is huge. Just like preserving some of this beautiful pieces of this great nation. So I just am really excited about it, and so I started that. Got a vacation coming up where I should be able to sit down and get some reading done to
Awesome.
some more. But that was actually a sweet little gift from her.
Good.
Okay, so
Enjoy it.
Do that.
You're our guest, James. Why don't you tell us what your responses would be to those same questions?
2 questions.
So I think probably the billboard would say "Smile More," which is awesome because heck yeah, man, I got to represent it. Most people don't, and I would stick that right in the middle of every city. And then the book I'm reading right now, I actually have over here as well. It's 0 to 1, which was actually that was.
Cover?
What's that?
What's the cover? I'm a visual guy. No, cool.
So this is a good book by Peter Thiel. That was a recommendation of Pete Dupuis, which is actually Eric's business partner. He kind of recommended that for people starting out business and whatnot. So there's a lot of valuable information in there that I've been using. So very good book to anybody kind of running and starting a business.
That's cool. Yeah, they're kind of all over the place. The books, I love it.
Heck yeah.
Awesome, man. Well, thanks for being on our show, and we'll get you to stay on when we come off air real quick, just to touch base real quick. Real
Sounds
quick,
good.
time for you to plug yourself. Again, we really had to, and by the way, everyone, this is our 10th podcast. We're pretty excited. Hit the double digits. I know we're just babies with the podcast, but we're in double digit land. You get to have a big time birthday when you hit 10, so I think this is a celebration. And
Hell yeah.
we will let you talk about yourself for a second, how people can get a hold of you if they want to learn more, email, Facebook. I'll basically just cover all your social media outlets and everything. And then we're also going to post it as well, so go for it.
Yeah, to be honest, just check www.drjamesspencer.com. Honestly, is probably the best way to reach me via email there, or just check me out on Facebook at James Spencer or Dr. James Spencer, and that's the best spot to get me. And then also on Instagram, Dr. James Spencer.
Perfect. Sounds great, man. Well, thanks again for being on our show.
Hey, thank y'all.
A lot of knowledge. I appreciate it. And cool, man. We'll talk soon.
Hey, thank you guys.
Yeah, thanks, James. Thanks for coming on. Hey, good night, everybody.
See you guys.